Hello, and welcome to this episode of the program, Easy Access to Healthcare for All Nigerians. I am Kauthar Anumba Halil, standing in for your regular anchor. One strategy that the National Health Insurance Authority has adopted to help it achieve its mandate of universal health coverage is collaboration with the state social health insurance agencies under the Health Insurance Under One Roof initiative. This strategy decentralizes the provision of health insurance, bringing together all stakeholders within the health insurance ecosystem to work towards the attainment of universal health coverage. The importance of health insurance under one roof initiative cannot be overemphasized, as the initiative has yielded quite a lot of gains. It is in the light of that the NHIA organized a 3-day quarterly peer review meeting between NHIA, NASSCO, and state social health insurance agencies, which held in Abuja. This meeting serves as a platform to strengthen collaboration with stakeholders at the subnational levels. Let us bring you details of this meeting as the program unfolds. Keep watching.
It is a program that is designed to ensure nobody is left behind in the health insurance ecosystem.
It's an excellent scheme to support Nigerians.
I've been benefiting from this scheme.
It's very nice. We're really enjoying it.
We appreciate their effort.
First on the program is a highlight of events around the NHIA. In the news, NHIA commissions prototype office in Kwara State. These alongside other stories coming your way shortly.
O God of creation,
the National Health Insurance Authority on Tuesday 21st February 2022 commissioned the new NHIA Kwara State office. The event had in attendance top government officials alongside stakeholders across the health sector in Nigeria. While delivering his remarks, Professor Nasir Mohammed Sambo, Director General NHIA, said the move is part of its strategic infrastructural development process to build corporate offices for the NHIA across the nation. He added that over the years, the authority has spent so much on rent for state offices, but this move will help it to save resources as well as improve its corporate image.
This is a momentous occasion for the National Health Insurance Authority as we embark on strategic infrastructural development process of building new corporate headquarters in FCT and prototype state offices across the nation. Our decision to build these prototype state offices was born out of the need to save the authority amount of money that we had been paying for rental offices for several years across the country. In addition to that, we learned that fully decentralized operation of our business process to state offices and providing fitting and functional offices space to our growing human resource base will enhance the authority's corporate image and improve services to our tenant needs. As we all know, the challenges of frequent office relocation, quit notices, ejection without cogent reasons, and outright sale of rented properties by owners without notification have been a major hurdles that have been impeding our progress.
Also speaking at the event, Professor Ibrahim Gambari, Chief of Staff to President Muhammadu Buhari, commended the NHIA for its continuous effort in achieving its mandate and embarking on reforms that is putting it on a good trajectory towards the attainment of universal health coverage. Gambari further restated the support of President Buhari's administration for the NHIA.
This landmark event is yet another evidence of President Muhammadu Buhari's administration focus on the establishment and maintenance of critical infrastructure across the length and breadth of our great country Nigeria in order to address the needs of our citizens and legal residents. The Buhari administration is particularly interested in the health and well-being of its citizens and legal residents. I think it was a great philosopher who once said, "Mens sana in corpore sano." A healthy mind in a healthy body. The health and well-being of the citizens of Nigeria is central to the progress and development of our great country. And we also want to recognize the prominent position that the health sector has in the next level agenda of President Muhammad Buhari, GCFR. Specifically, this administration has also made giant strides towards the attainment of universal health coverage in Nigeria by ensuring the operationalization of the Basic Healthcare Provision Fund, BHCPF.
Other dignitaries at the event were Senator Yahya Olori-Egbe, Chairman, Senate Committee on Health, as well as royal and spiritual leaders. In continuation of his familiarization tour to critical stakeholders in the state, the new acting coordinator, Edo State Office, National Health Insurance Authority, Ehanire Theodore Osa, paid a courtesy visit to the Nigerian Union of Journalists Edo State chapter in Benin City. The meeting is aimed at strengthening relationship between the NHIA and the media, especially in the area of deepening awareness on NHIA programs to the public. Speaking at the meeting, Ehanire used the opportunity to sensitize members of the union on the authority's flagship program, the Group, Individual and Family Social Health Insurance Program, GIFSHIP, designed to expand coverage to the informal sector of the population. He said the program was a part of the many reforms of the Director General of the authority, Professor Nasir Mohammed Sambo, and has received significant buy-ins across the nation since its official launch. Ehanire added that the program presents the prospect of driving the nation's health sector towards attaining universal health coverage in no distant time. Receiving the NHIA team on behalf of the union, the chairman, Mr. Elelke Festus, who thanked the acting coordinator for the visit and pledged his support to the NHIA state office in helping to transmit the message of health insurance to the good people of Edo State.
The NHIA quarterly peer review serves as a platform for the authority to meet with CEOs of state health insurance agencies across the country to discuss ways to move the health insurance sector forward. At this particular meeting, the National Social Safety Nets Coordinating Office was included as the NHIA brainstormed on ways to use the National Social Register to expand health insurance coverage. Let's get details of the meeting in our next segment, Issues around the NHIA. Please don't go away.
The National Health Insurance Authority is a government agency that is responsible for giving succor to Nigerians through health insurance. The agency does not only cater for people in the formal sector, but also in the informal sector, especially the vulnerable who cannot pay for themselves. It also operates a decentralized system, a national body at the top and subnational at state levels. Due to this collaboration, the NHIA Gateway Basic Healthcare Provision Fund is executed at the state level under the supervision of the state's social health insurance agencies.
It's not a program or a project, but it's a funding or financial intervention to the health sector, so that the health sector will have additional extra source of funding. So it's the main vehicle, financial vehicle, to finance that basic minimum package of health services as specified by the National Health Act. What is the overall aim of basic healthcare provision? The overall aim is to significantly drive the nation towards achieving or attaining the universal health coverage in line or in accordance with the National Survey Planning, Health Planning Part 2 in a long time, and the SDG in the short term.
This gateway is supervised by the NHIA and implemented at the state level and serves as a medium that cements the relationship between the NHIA and state social health insurance agencies.
The Act clearly stated that the funding of the basic health care will be through the federal government annual grant of not less than 1% of its consolidated revenue fund. Then from donation and grant from partners and donors, and 3 from any other source like investing the fund, and also interest that we accrue from the investment, then from private sector.
In a bid to strengthen its decentralization strategy with states, the NHIA organized a quarterly peer review meeting between NHIA, National Social Safety Net Coordinating Office NASSCO, and state social health insurance agencies.
We have
the meeting held in Abuja. The objective of the meeting was to review and address issues emanating from the previous meetings with the state social health insurance agencies, SSHIAs, and the NHIA. Educate the SSHIAs on the focus of the NHIA for 2023. Update the states on progress made in the implementation of health insurance under one roof. Discuss challenges of collection, collation and integration of data. Discuss the need for partners mapping to address the issue of fragmented partner support across the state and country. Brainstorm with NASSCO on exploring the use of social register to expand health insurance coverage.
It is my pleasure to welcome.
Speaking at the event, Professor Nasir Mohammed Sambo, Director General NHIA, said the success of the collaboration between the NHIA and the states represent the health insurance picture in Nigeria and will bring about the attainment of universal health coverage.
As we are all aware, the health insurance space in Nigeria is decentralized. There is a national body at the top, and there are subnational levels. And the aggregate of what these two levels do brings the totality of the picture of the social health insurance in Nigeria. And where you have a decentralized system, there must be a very credible coordinating mechanism to be able to have a platform where ideas will be shared, where ideas can be cross-fertilized, where challenges can be collectively identified, and where solutions to the challenges can be collectively addressed. That is why under our reform system or our rebranding agenda, we say that strategic stakeholders engagement is one of the key elements in the second pillar of our rebranding agenda.
Setting the ball rolling was a presentation by Dr. NASSCO on the strategic focus for the year 2023.
Our focus for 2023. 2 things. We are preparing for the big picture and we want to consolidate on existing strategies. Not all the strategies, we just selected a few that we should really focus on. So how do we prepare for the big picture? Essentially, we want to implement the NHIA Act 2022. It's been signed, we've been waiting for over 20 years, so now it's been signed, what next? So we said we're going to constitute and inaugurate 3 committees, like the DG mentioned earlier. The Committee for the Development of the Operational Guidelines, the Committee for Implementation of Mandatory Health Insurance, and the Committee on Innovative Financing, primarily for the Vulnerable Group Fund. So those 3 committees, as was mentioned, one of them has already been inaugurated and has started work. The other focus is consolidating on the existing strategies. And we asked ourselves, how do we leverage existing strategies so that we can scale up health insurance coverage? And we selected a few strategies. One is to strengthen information, education, and communication. Information to all our stakeholders, information to our enrollees, even information within ourselves as an organization, from the person at the top to the least person within the organization. They should have the information that they need to function optimally.
Dr. Sikiru Salawuddin, Acting General Manager, Informal Sector Department, gave a presentation on the implementation of BHCPF, success, challenges, and the way forward.
So far, so good. As at January 2023, the authority or the gateway has received and disbursed a total sum of 39 billion 592 million 429,726 naira.
High point of the event was the interaction between NHIA, SSHIA, and National Social Safety Net Coordinating Office (NASSCO). Its objective includes to review utilization of National Social Register (NSR) by state social health insurance agencies for the identification of the poor and vulnerable households for enrollment into the BHCFP, explore the possibility of expansion of the social registers in the states, amongst other issues. Speaking at the event, Dr. Gaza Gwamna, Chairman, Forum of State Health Insurance CEOs, speak on the impact of the meeting.
They give us opportunity to be able to review what we've done, what we're doing, and then to see what we're going to do and do it better. So this has been able to help us in the implementation of, different schemes, especially the Basic Care Provision Fund that will have direct connection with the NHIA as far as funding flow is concerned. So it's been able to better the scheme, because when we started 2-3 years ago, we were not at this level. And now at least we've been able to make some advancement, we'll have some gains, though it's not been perfect, but at least when we come like this, we're able to look at some of those challenges so that we'll perfect our strategies, and that has actually helped a lot. So perfecting our strategies, it's not just coming around to just come and talk theory. Some experience sharing always come from the field, and when we put them together, we proffer solutions collectively, and then we'll go back and implement them.
Welcome back. Today on our Stakeholders segment, we will bring you interviews with participants of the 3-day peer review meeting between the NHIA and CEOs of state social health insurance agencies. They speak on the significance of the meeting.
The meeting is very significant, it's very important, and I am very much happy that I am around, because it's moved me beyond what is written in a paper to what is practical. And the discussion so far has shown that insurance can be achieved. It is a practical activity that if you do it within the confinement of law, you are going to achieve results.
This is a vision of the new DG of the authority to bring all the health insurance stakeholders under one roof. So every 3 months we gather to review our performances and to take action on any challenges that we are facing. So we are very happy that we have this kind of leadership at the national level, that we are gathered and the leadership of the NHIA listens to our challenges and try to address them.
Some say the meeting will help put the health insurance space on a good trajectory of attaining universal health coverage.
It's important that while policies are laid out at federal level, you listen to those that are actually implementing, you get the feedback, and we are able to now, in real time, monitor what we're doing and ensure that we are moving in the right direction. So definitely, I feel that these quarterly review meetings are very necessary and extremely important.
This gathering provides us with the opportunity to do a quarterly review of our relationship and the workings towards achieving universal health coverage in the country.
Dr. Chidi Ubani Ukoma of Abia State Health Insurance Agency said with the health insurance under one roof initiative, the import of such meetings cannot be overemphasized.
Yes, health insurance under one roof, that's where all the stakeholders in the health insurance ecosystem come together. NHIA at the top and the shares. That's where we have this peer review meeting, quarterly review meeting with all the shares. So with all the ideas that have come up, all the deliberations, and charting a way forward, if we can implement all that we've reviewed today in this first quarterly meeting, I believe it will place all the stakeholders, NHIA, together with the shares on a pedestal to working with other stakeholders, that is the Federal Ministry of Health, National Primary Healthcare Development Agency, to achieving universal health coverage for our country, Nigeria.
Participants of the three-day meeting giving us their perspectives of the review meeting. Up next, your questions answered. Just stay tuned.
Where do I register? How can I get enrolled? Where do I register? How can I get enrolled? How can I get enrolled?
Question: does NHIA cover delivery commodities?
NHS, when we talk about delivery, what NHS does is that there's a difference, a little difference, or when you say the word commodities of a wider range. So what NHS does is that it covers all the drugs and also the consumables. The word consumables are the ones that are more medically related. Things like syringe and needles, things like gauze that they use during the delivery, things like cotton wool, and things like sutures that they use for suturing during the process. But other commodities like soap, like sanitary pad, like the diaper pack that they use to clean the baby, such type of commodities are not covered under the scheme. So I think the enrollees or our mothers that are going, that is to the maternity area, should get this thing clear, that it is only the consumables that are being covered.
Where do I register? How can I get enrolled? Where do I register? How can I get enrolled? How can I get enrolled?
And so, we draw the curtains on this week's episode of the program. Please make sure to visit any state office of the NHIA for complaints or redressal on issues encountered in the course of accessing the care. See you next week.